Let's talk Very Well Health Special Edition ADHD magazine. I'm Dr. Rebecca Fontanetta. I'm a board certified pediatric neuropsychologist, and I want to review some of the most important points of this edition. So, number one, I love that they pointed out that ADHD is not a single condition, but a cluster of symptoms that can change over time and present very differently from person to person. This is because ADHD has a strong genetic component, but also can be brought on for environmental reasons. So, for example, a traumatic brain injury. We know that red dye and food additives can exacerbate symptoms. Trauma can exacerbate ADHD. Lyme disease, sleep apnea, epilepsy. So there's a lot of reasons that ADHD would present in a very different way. So sometimes people have slow processing speed, sometimes it's more behavioral and they're hyperactive or impulsive, or sometimes they just have trouble with organization, they're losing things, forget why they walked into a room, they have trouble with academics. So ADHD can mean a lot of different things and it can look very, very different from person to person. As far as adult ADHD, so adult ADHD is not a ADHD that comes about in adulthood. It's ADHD that was essentially missed for one reason or another in childhood and then is diagnosed in adulthood. It can actually be harder to diagnose because the symptoms or traits present are different than those in children. Oftentimes, by the time you reach adulthood, you learn to compensate or you learn to mask, especially socially. You also might carry a lot of co-occurring diagnoses, so it's hard to differentiate. It can also be challenging because the person may have other medications that they're taking that can interfere with assessing true symptoms. Now, during the pandemic, there was a significant increase in ADHD diagnosis and prescription of stimulants, mostly in adults, actually, not children. And this was because there was so much added stress, not surprisingly. A lot of people were working from home. There was a lot more awareness on social media. There were a significant increase of telehealth services. So instead of people being on wait lists to be seen in person and, going through these several hour appointments that we do, they were being seen for 15 minutes on telehealth, reporting that they had difficulty focusing and they had trouble doing their work, and they were being prescribed Adderall or something similar. So it went from 2% of people being diagnosed via telehealth to 40%. Telehealth can be an amazing thing because it can help people who don't have access to services. However, it can also take away things like in-person behavioral observations, getting an adequate history, and being able to do more formal assessments in person. In terms of girls versus boys, not surprisingly, boys are more often diagnosed with ADHD, and that's sometimes because girls have more what we call internalized symptoms. Instead of outward, where they're aggressive or loud, they kind of withdraw or feel anxious. And this can sometimes lead to harmful or risky behavior, such as rejection sensitivity, reduced self-esteem, somatization, which is anxiety experienced physically within the body, depression and anxiety, an eating disorder, sleep difficulties, or even substance abuse. The other thing that's important to note is there's no singular test for ADHD. So I'll have people reach out to me, and say, I want the ADHD test. It's not, like a blood test. It's a series of tests and a series of observations to make a clinically informed diagnosis in which you're conceptualizing all the information, not just from testing, from interacting with the person, from talking to, parents, friends, teachers, family members, whomever. If they're an adult, understanding their employment history. If they're a child, looking at their history of school records, medical records. There is not one test for ADHD. It's an entire evaluation. Even the tests themselves, for example, looking at sustained attention, there's many different ways to do that. And it becomes more complicated because at least 2/3 of children and adults have more than one diagnosis aside from the ADHD. Something that many children and adults with ADHD experience is something called ADHD paralysis. This is the feeling that you have so much to do that you literally just don't do anything. Not because you don't want to, not because you don't care to, because you just physically and mentally cannot. And this is suspected to be related to the decreased amount of dopamine in the brain. One of the things dopamine is responsible for is to motivate you, is to get going, to initiate something. So when people experience this, they tend to avoid or procrastinate. They get stuck in overthinking. Their mind goes blank. They feel fatigued. They don't know how to start. They can feel brain fog, or they can have a difficulty coordinating their mind and body in terms of what they're trying to do. Now, stimulants can be helpful. There's both short-acting and long-acting, long-acting being the extended release. Short-acting can be really helpful for people, especially for, a test or important project or something like that. However, the short-acting forms can lead to more dependence and more side effects. Typical side effects can be reduced appetite, difficulty sleeping, irritability, and stomach aches or nausea. The research on supplements for ADHD is complex. I'm just going to refer to what was in this particular magazine, and essentially they said there may be some support for omega-3, iron, zinc, magnesium, vitamin D, and whey or plant protein. However, they also highlight the fact that this is really if there's a secondary deficit. People with ADHD often have more deficits in these particular nutrients. So if there's a true deficit, it can be helpful. If there's not a true deficit, there's really no need to supplement with these. They also caution against refined sugar, caffeine, and food additives. So all in all, ADHD can look really different. It can present really different if you're male, female, if you're young, old. It can look really different if it was purely inherited or if it was acquired during your lifetime. There's a lot of treatment options, including therapy and social skills group and mindfulness. So you really want to cater to what the child or the adult needs and make sure they feel validated, make sure they have the right supports in school, in work, at home to really understand what you're looking for and not just jumping to a treatment or a solution.